Alright, this is the peer support training video. This is for this training is for people that's doing the peer support training. Alright, to begin, you want to first pull up a PowerPoint, and to find a PowerPoint you go to Dropbox, and you go to Pregnancy and Smoking Cessation Study, Step 4 Intervention, Nick Thor, Documents, Peer Support Training, and look for the most recent PDF file of the PowerPoint, and you come to this. Alright, so this is where the training for the peer support begin. Even before that, like all other visit, you start the training with starting the audio recording, and then just for the first visit, you will also do the urine test and the breath CO test. Regardless of the result, this will happen only once for the first visit. Some people might ask, okay, so during the urine test, do we still do the pregnancy test if the peer support is a male? And the answer to that is yes. The reason for that is because we want to keep the test consistent with the pregnant patient. Okay, so urine test and breath CO test on the first visit only. Alright. And then another thing you want to do is the consent form. The consent form is the same thing with the patient, where you review the consent form with the peer supporter, going through the important points that I mentioned in the lab screening visit, and then the only difference is you could sign the consent form with the peer support during that visit. Same thing, have 2 copies, one for them and one for us. Alright. And then after the consent form, you move on to the survey. There's a peer support pre-test survey. They will have to fill that out. And there's actually 2 surveys. You want pre-test, the peer support pre-test survey is one of them, and then another one is the peer support and peer interaction survey. Right, so 2 surveys they have to go through. Alright, and then after that, you can begin. After the 2 survey, you could begin the lecture slides. Okay. So one thing about the peer support training is that don't worry. There's no solid guideline where to stop for each visit. You just kind of go through as much as you can, because sometimes the peer support can only stay for so long, or the peer support is trying to synchronize with the patient's visit, which is probably in the other room. So depending on how the time goes, you just keep on going through the lecture slides until you're done. Usually they will stay here about an hour, depending on how much they talk, and what you talk about. The amount of visit will vary between one visit and another, and how much